So, hello everyone. In my series, Salute to the Heroes, I was looking around and I found a lot of youngsters, our youth, our younger generation stepping up to the plate. When this virus hit, this pandemic of coronavirus that we are fighting together, when it comes to our younger generation, they don't step behind. They have shown us how they can even be better in terms of thinking and smart ideas and can help us. So today I have with me uh, Mrs. Jasmin Bhathena and her daughter, who's 16-year-old. She's a 10th grader at Phillips Academy, Myra Bhathena. And she and her mom is a pediatrician. So I guess she heard a lot of stories of people getting admitted, elderly, sick people getting admitted in the hospitals. And as we know, the way the illness is, because of the risk of transmission, the families are not allowed to visit them. So they can't have no visitors when they're in the hospital. So that affected Myra at some level, and she decided to do something about it. So let's hear her story. Hi, Myra. You can introduce yourself.
Hi, I'm Myra. Thank you for having me here.
Absolutely, my pleasure. So when did this start? When did when you heard these stories, what happened in your mind?
So a few weeks ago, my mom came home and asked if we had any used iPads that we wanted to donate because she told me that COVID-19 patients are not allowed to be visited by any of their loved ones, but also they often don't have any of their own devices to even stay connected and FaceTime or call their family and friends. So I decided to do something about it. So I started a website, and we now have so many devices coming in, and we're sending them out as soon as we can to hospitals around the greater Boston area.
So what's the name of your website?
The name of my website is Connect Against COVID. You can find it at connectagainstcovid.com.
And that's not easy to forget. Such a good name, Connect Against COVID. This fight, we fight against it. So what was the response from the community? How did you, were there people calling you and saying, I have something, come pick us, or can I drop it?
Yeah, so we've gotten so much response through the website where you can actually contact us and let us know what you have, what you're donating, and if you have any questions, concerns.
And what sort of device? It can be iPhone, iPad, Android, Samsung, like anything, any phone, any iPad?
So right now, hospitals are really just wanting iPads. We have found a few hospitals who will accept iPhones and Samsung devices and Android devices. But we are getting a huge mix of different devices right now.
So when you get this, do you have to do anything to get it ready to be given to patients and hospitals?
Yeah, we have a whole procedure at home. It's right over there, actually.
Do you have assembly line?
Yeah, exactly. So we have to first take out all the devices from their boxes and clean them with Lysol or disinfectant. Then we make sure it has a charger, make sure it's charged. And most importantly, we have to make sure that all the data is erased from the device. So it's completely cleaned and ready for a new owner.
So you have that on your website that before people send it off, they should, but sometimes they don't. Sometimes they don't know how to. People like me would not know how to do that. So then you have to do it?
Yes.
How long it takes to erase that data?
Most of the time, it's just a few minutes to go through a few steps on the device, but unfortunately, sometimes devices are connected. For example, iPads can be connected to the owner's Apple ID. So then we aren't even able to get into the iPad because it is locked. And even though it may be erased, it's still connected to the ID.
And you are wearing gloves and masks when these things come in, and you wipe them down and everything. And then how is the delivery happening? Are you bringing it to the hospitals?
So what we had done is, the first few days that I was looking for iPads, she asked some of her friends and she said, this is too slow. Why don't I try to start a website? And she had no idea, so she went and did what was that? So she got online and learned how to start a website. And, I'm not technologically savvy. And so some of my friends were like, so ask Myra what to do. And I said, why don't you just put it all? So she's actually on the website, introduces how this idea came along. She's very close to her grandparents, and she messages them every night. So not being able to connect with them would have been hard. She actually on the website has put in information on how to remove your personal data, if it's an Android, if it's iPad, and other things. When we get them, she does all of it. It takes a few days. And then on the weekends, we have been driving to different sites. The hospitals really don't want young kids coming in or non-medical, anyone at risk. So we're actually meeting at parking lots and transferring. And she's done a good job of, making sure they're all in clean Ziploc. So we have done 3 deliveries so far, and it's
How many deliveries have you done?
3 of
And
them.
where? Which hospitals?
To Beth Israel Deaconess and the affiliated Atris Health affiliated hospitals.
Okay.
And then the second shipment went to Tufts. And Tufts is one of the hospitals that really prefers only iPads. And then to Beverly Hospital.
And then how do they make it functional? On their part, do they have a lot of stuff to do?
So their IT department generally knows how to set it up. So as long as we have it cleaned and ready for them, hospital's IT can just get it ready soon.
Okay, how many devices roughly have you sent in the 3 deliveries?
We've collected over 50 devices right now, and we've sent about 40. We have.
Good job. Have you heard from any healthcare or nurses or anybody responded back saying, yes, your device was used for so-and-so patient?
So I don't think we have put it anywhere that these devices are ours or
It's all anonymous.
But the person bringing it in fact, she's a radiologist who took it in, and she asked us again, it's working. Do you have any more coming in? So so it's we know they're getting there. We know it's working.
Right.
It's and we have nothing of the person or ours on the iPad. So hopefully they're making it.
Yeah. Someday some nurse will release a picture or a video of somebody actually using it and being very, happy talking to their family, and it will be so rewarding. It's already is, right? How do you feel about it, Myra? It was your idea and you're doing this.
I just mostly feel thankful because I've gotten so much help from everybody, my parents especially, of course, but just the response I've been getting from my friends, my family, and even people I don't know. Everyone has been so appreciative, and spreading the word has been awesome. Everyone has taken that initiative.
That's true. And this is the positivity that needs to spread with all the negative, which is true, which is reality. So we hear so much about it, but these positive messages, it boosts the morale of people out there, and it makes you feel like you're part of, you're one, right? All of us are one. And when we join together to fight, we can do this.
Exactly.
So are you going to do a project about this when this is all over?
What do you mean?
Like, maybe a small, talk at the school? Or I think you would be famous by then. Everybody would know that you did this.
No, I actually do want to bring it to my school and start a club there. And even if it's not about coronavirus, we can start doing this for other people.
Other people who don't have.
Homes, and
that's true. And actually every family probably have at least 2 or more such devices, because the newer versions keep coming. And in our quest for getting more, being materialistic, it's hard to see how much sometimes, these are the days when you look around and see, we are blessed, we have so much, and some people don't have, so it's very nice to step up like that and think you had your own share of, you have all your schoolwork, you have so much going on, and this takes probably a lot of extra time, but it's very rewarding, I bet. And it's very nice of you to be doing this. Keep up doing this, keep up the good work. This is amazing what you're doing. And if you need any help, absolutely, we will put the name of your website and everything on ours so that we can spread the message.
Thank you so much. I really appreciate it.
And I appreciate you too giving me your time. And also, just before we go, Dr. Jasmin Bhathena, you are a pediatrician, and you've been working continuously through this. and seeing your pediatric patients, right? How's that going?
Yeah, it's been stressful trying to take care of normal healthy babies, and we have done a great job in separating sites. So we need, babies are born, and unfortunately the hospitals are sending them out sooner than usual. So
Right.
both the moms and the babies are very fragile when they first come in. So that's taken some work. And the sick kids, parents worry about their sick kids. They don't mind being home if they're sick, but if their child needs to be seen, they want to be seen. So it's, we've done, it's been a change, a new way of doing medicine. We're doing a lot of video medicine like you all are, but yeah, but
Yeah.
for us, we need to see a lot more of our babies and patients. So
Yeah, all good job. So you also keep doing the good work, and I can see, how the genes and environmental, upbringing helps, and it sows the seeds of, and that's what we see in our youngsters. What you are doing, you're doing so much. You are a hero yourself, and of course, that's why that's where she gets it from. So thank you very much for being on my show, and take care, stay safe, and keep up with the good work.
be,
Thank
be
you.
well. Thank you.
You as well.